Take a moment to imagine your life with a significant number of allergies and intolerances. Imagine a life where entire food groups are taken out of your diet. No dairy, no gluten, drastically reduced sugar intake. The list continues to grow. Imagine living your life in chronic pain. Imagine feeling what a 5-year-old explains as monsters in your tummy that are consistently cutting you and punching you. Imagine fluffies in your belly that are described as biting you over and over again. This is the life of 5-year-old Dane Gilbertson. Dane is not a stranger to struggle and perseverance. Being born premature and with a cleft palate, Dane learned to adapt at a very young age. This little boy greets each and every day with a smile on his face, never letting anything get him down. By the time Dane was a few months old, we knew there was something wrong. Dane was not growing at a normal rate, was never on the growth chart, and was in consistent gastrointestinal distress and discomfort. It took 2.5 years for Dane to be diagnosed with disaccharide enzyme deficiency and celiac disease. But it doesn't end there for Dane. The uncertainty, the pain, and the discomfort continues. Endoscopies show inflammation in the small intestine and villi atrophy. The pain is unbearable and extreme. Dane continues to be a fighter. Now take a moment to further imagine. Imagine a life with very little food options. Imagine a life where family gatherings and social outings leave you sitting at a table, watching everyone else eat full meals. Imagine a world where formula is something that is not just for infants. It is something that you will eat for the rest of your life. Imagine having a feeding tube. Imagine a life of feeling different and like nobody understands. This is the life of Zoe Gilbertson. Zoe suffers from a very rare gastrointestinal disorder called eosinophilic gastrointestinal disease. Eosinophilic diseases are conditions where the body's immune system treats food as a harmful entity. In response to food, the body rapidly produces too many immune cells called eosinophils. Eosinophils rush to the esophagus, stomach, small and large intestine, causing inflammation, tissue damage, severe pain, vomiting, diarrhea, and bleeding. Eosinophils can even infiltrate the bloodstream and damage other organs. This response often becomes so severe that children are unable to get the nutrition they desperately need to grow and develop. All of us have treasured memories of birthdays, parties, and holidays. We gather together, sit around the table, and celebrate with fellowship and food. But for Zoe and our family, each of these gatherings are a reminder that her life is different than those of family and friends. Again, let's imagine sitting around the dinner table at Thanksgiving and not being able to eat what everyone else is eating, as it would leave you in severe pain and suffering for days. Imagine telling your child that they can't eat meat, most fruits and vegetables, and many snacks that children their age enjoy. How do you begin to tell your child that they may lose their safe foods and not eat by mouth again? Our family struggles with questions like this every single day. Surgery, medical procedures, medication, and suffering are a part of Zoe's daily life. While some patients with eosinophilic gastrointestinal disease can control their disease by eliminating some foods, others, like Zoe, are required to live on extremely restrictive diets. Zoe can tolerate nothing more than a handful of foods. However, foods that are safe today might not always be safe, which may leave Zoe purely on an elemental diet. In August of 2019, due to the unpalatable taste of the formula and being sick of eating her safe foods, Zoe refused to eat by mouth, leaving our family with no option but to get Zoe a feeding tube. Daily life is difficult, complicated, and exhausting. Common childhood illnesses that others consider an inconvenience can quickly become serious for Zoe. Despite the challenges Zoe faces, she is a fighter. Each day she courageously works to do things that others take for granted. She reminds us all every day that she is more than her diagnosis. Pain, cramping, discomfort, bleeding, vomiting, diarrhea are normal and daily occurrences for both Dane and Zoe. Dane and Zoe have an amazing team at McMaster Children's Hospital who advocate for them and work tirelessly to help them. Currently, Dane and Zoe are having extensive genetic testing done to hopefully help answer some of our many questions. Because this disease is rare, Zoe travels hundreds of miles away to Cincinnati Children's Hospital, where they are the leading hospital in research and knowledge for eosinophilic diseases. A better understanding of this disease and treatment has the power to change Zoe's life. Dane will also be accompanying Zoe to Cincinnati this summer, as the team would like to assess Dane and his gastrointestinal abnormalities as well. We strive to spread education, advocacy, and public awareness to find a cure for this horrific disease. By supporting Zoe, you are giving her the one thing that everybody deserves: hope. Imagine living just one day like this. Thank you from the bottom of our hearts.